Thank you for joining us and welcome to Better Together Live, where we create helpful community connections when it matters most. I am Yamile, your host and the Community Relations Coordinator here at TherapyWorks. And today I'm very, very happy to be joined by Jennifer Bradley-Weiss from San Jose Behavioral Health. Thank you, Jennifer. And are you the Outpatient Service Program Manager, correct?
Director of Outpatient Services.
Perfect. Thank you so much for being here today.
Absolutely. Thank you for having me.
Great. Just to give you a little bit of history or background, we started Better Together Live to highlight local resources like San Jose Behavioral Health for our community, so they can learn what's out there when we need it the most, right? So thank you again for being here today.
Absolutely.
Before I start to all the questions I have for you, can you tell us a little bit about yourself?
Absolutely. So I am a licensed clinical social worker. I've been in the field for, probably 12 or 13 years.
Wow.
I've done a little bit of everything, which is what's wonderful about our field. We get to work with so many different populations and types of individuals. So I've done many years of work in the autism field, working with children and young adults on the spectrum. I've also worked in the foster care system, and I've done private therapy and mental health. And I love working in acute mental health and in this field. So really happy to be where I am.
Well, you're amazing. And thank you for doing what you do. Yeah,
thank you.
Absolutely. So let's talk about San Jose Behavioral Health. It only treats mental disorders, correct?
That is correct. Yes. So I'll give you a little bit of a rundown about the different services that we offer here. So we are an 80-bed inpatient hospital for inpatient crises, mental health. So individuals who are in acute mental health crises, danger to self, danger to others, or, are in the throes of psychosis and unable to care for themselves. And so that's very short term. We stabilize, keep them safe, and then refer them out to outpatient services. So what I do is I oversee our outpatient department, and we have both IOP and PHP services here.
Correct.
So they are, yes, as you said, just mental health. So we are not a dual diagnosis program or a substance program. We are mental health primary.
Okay. And maybe this is a bigger question than I didn't want to ask you a big question, but what are the most common I know, thank you. Yeah. What are the most common mental health disorders that comes through the door? And again, this is a huge thing, but.
Oh, yeah. Yeah, no, it's an important question though. So in our program, we see probably depression and anxiety the most frequently, followed pretty closely by bipolar disorder. So we see a lot of individuals struggling with that diagnosis. We are also a trauma-focused program here in IOP and PHP. So we see a lot of people with co-occurring PTSD diagnoses or other forms of trauma. As we all know, that can be a wide spectrum.
Exactly.
So,
right.
Yeah, those are the top diagnoses that we see. We also treat individuals with various psychotic disorders, so schizophrenia, schizoaffective disorder. However, unfortunately, that population can be a little less invested or engaged in services, so it is a smaller subset of who we see coming through our doors on the outpatient side.
And this is adults only, 18 and over, correct?
Correct. Yes, correct.
Okay, so due to the pandemic, and I'm sure you got that question asked so many times because that's what we do too. Due to the pandemic, did you see an increase in mental health disorders? Do you think many people with already existing, mental problems had to seek for more, higher level of care from you guys?
Yeah, absolutely. And I think we're seeing that across the board in mental health at all levels of care. The pandemic has been horrendous for everybody. And individuals who had pre-existing conditions, we were seeing really a worsening of that. Especially in the beginning, you know, people were really taking that 3-week shelter in place very seriously.
Correct.
And then once we saw it was going to be a lot longer, you know, people had not been leaving their homes. They had not been seeking treatment. And for those with existing conditions, we really did see a spike. As things worsened and progressed with the pandemic, we started to see a lot of individuals who had never had any kind of mental health treatment or problems being hospitalized at the inpatient level for bipolar breaks, psychotic breaks, things like that, and then stepping down from inpatient into our services.
Right.
So we really saw it across the board. And we're seeing a big spike right now too, as things have been lifted and people are going out into the world. And so we're seeing quite an influx within the last month or so.
Well, this social anxiety is kicking up again because, you know, people who already, what we're saying, had some existing conditions about, you know, like anxiety, going back to the world out there, it's causing a lot of stress.
Yes, absolutely.
So I totally understand. And, you know, if you remember the first month or so last year when we start shelter in place, everybody said, okay, I'll see you in a month, you know?
Right.
We still on telehealth, all our sessions. Yes. Oh, geez. Oh, my God. Can you talk about your adolescents in patients? You mentioned that in the beginning. Can you kind of talk a little bit about that?
Yes, absolutely. And prior to me opening our outpatient department several years ago, I did work on our adolescent unit. As a social worker, I did. So I definitely know the ins and outs of that program. So it is a 17-bed inpatient unit, ages 14 to 17. It is co-ed. So although we, of course, have extra staff on the unit to make sure that the teenagers are well monitored and separated. So on that unit, we see a lot of depression, a lot of anxiety, suicide attempts, suicidal ideation, self-harm. Unfortunately, a lot of children who are coming from the foster care system or, you know, just really impacted home lives.
Dysfunctional families and all that,
Yeah. So the length of stay for our adolescents is typically, I would say, on average 5 to 7 days, although we do have individuals who stay a lot longer if they're very acute. And since it is a voluntary unit, meaning their parents can provide, you know, consent for them being there past their 5150 hold.
Okay.
Which is how they're initially brought in. And so that unit is especially important for those follow-up services. So each individual on the adolescent and adult units are assigned a case manager here at the hospital who follows them throughout their stay and makes sure that they have those follow-up appointments set up prior to them leaving the hospital. And for the adolescents, it's largely IOP, PHP, or residential programs because we really want to make sure that they're well supported when they leave. So they're not going to be readmitting.
Correct. And since you're talking about, was going to be one of my questions, your PHP and your IOP program. So they come to you guys every single day, let's see, for the PHP.
Yeah, so for PHP, our patients are with us 5 days a week, Monday to Friday from 9 a.m. to 3 p.m. And then for our IOP, that's the less intensive of the services. They are here 3 days a week. We let them choose any 3 days through Monday and Friday to better accommodate their schedules. Yeah, and those are half days, so they're with us from 9 to 12:30. And then during the time that IOP and PHP are with us for the day, they're engaged in group therapy. We, of course, use a mixture of process therapy as well as psychoeducation, CBT, DBT skills. They also meet weekly with a therapist. And all of our therapists are also EMDR trained. So that's where that trauma piece comes in as well.
Yeah, I was going to ask you also that what kind of methods you guys use in your therapy. So
So in the group setting also, our second group of the day is a Seeking Safety. So I'm not sure if you're familiar with that curriculum.
I would love to hear that.
Yeah, so it is an evidence-based curriculum that is trauma-focused, and it looks at trauma and maladaptive coping strategies. So there are 25 different topics under the Seeking Safety umbrella. So we will generally do one a week and really dig in and help to process as well as provide that psychoeducation. So it's a good balance of both. in the seeking safety.
Okay.
Yeah.
Do you invite the family to come to some of the sessions?
Absolutely. We do family therapy as part of the treatment. So as I mentioned, they meet weekly with their therapist, and then they also have contact with our psychiatrist and with our nurse. Mm-hmm. So we provide medication management as well, and then family therapy or family sessions, as needed throughout the program. But we strongly encourage every patient who comes into our program to engage at least one of their supports in treatment, because as you know, it's such a strong indicator of success.
It is so important. We we are strong in that too when we're helping our teenagers. They need to. The family needs to be involved no matter what. Yeah.
Yes.
So what does a daily life in your patients look like?
That's a great question. So when they're here in treatment with us, you mean?
Yes.
Yes. So our IOPs have 3 groups a day, and our PHPs have 5 groups a day. So we start with a process check-in group. Then we go into our seeking safety. Mm-hmm. Then a psychoeducation group. We break for lunch. IOPs leave for the day. And then PHPs do 2 more groups after lunch, another psychoeducation and process ending group. Throughout the week, and it depends on, the scheduling with their therapist and their treatment team. Right. They'll be meeting individually with their therapist, individually with our psychiatrist, individually with our nurse as well. And I can tell you a little bit about the length of stays in the program as well.
Absolutely. Yes.
So if they start at the PHP level, which is the more intensive, typically it's on average 2 to 5 weeks at that level of care, depending on their progress and their acuity and their need. And then stepping down to the IOP level, it's generally about another 8 to 10 weeks at that level.
Okay.
If they start at the lower level of care, so meaning they're not acute enough to start at PHP, but they start at IOP, then it's a longer length of stay at that level. It's about 10 to 12 weeks total.
Right, that's about right. Yeah. Wow.
Yeah.
You guys are busy.
Yes.
That's great. So if someone needs to refer a patient who needs immediate assistance, how is your intake and assessment process? Do you guys have a waiting list right now?
Yeah, so we do have a little bit of a wait, but it's actually lightening up quite a bit. For example, I had an assessment today, and we're going to start her next week. So it's much more minimal, I think, than it has been in the past, or is for some other programs that I've heard about. As I said, everyone's impacted right now.
It is.
Yeah. So if you have a patient, or there is a patient who's needing assistance or wanting to go through the assessment process, we don't need a formal referral, meaning the patient can call themselves.
Okay.
It's wonderful if they have providers, if we can, of course, get some collateral from them for continuity of care. So they can call me directly. And I believe you have my information.
Yes, but I would love if you can share it with us.
Absolutely.
Yes, thank you.
Yes. So the best way to reach me, I think, is to call my desk line, which is 669-234-5959. And that's our main hospital line. And then my extension is 264. So if there is a patient who is in immediate crisis and might need an inpatient stay, then it's that same number with 720 is our admission line. Or they can press 1 as the prompt on our phone tree, and I believe it'll take them directly to admissions. But for outpatient, patients can call me directly. Therapists, psychiatrists, residentials, anyone who's wanting to refer can contact me directly, and we'll do a brief phone screening and set up an assessment as soon as possible and get them in the doors. Yeah.
Do you get any families that actually directly from the families, they brought their significant of the kids that directly? Okay. And all the process is sort of the same, right?
It's all the same. It's all the same no matter how they're coming, into treatment. It's all the same. And we see that quite a bit, especially with our younger adults.
That's what I thought,
18, 19, 20-year-olds. It's usually the parent that's calling, wanting them to come into treatment.
Wow, that's great. Jennifer, this has been so great. Is there anything else you would like to share with us? The floor is open for you. Please do so. Yes.
And first off, thank you so much. This has been a wonderful experience as
we love working with you guys. We really do. So thank you.
Feeling is definitely mutual. Yeah. So I don't think I have anything else to share. I think we talked pretty thoroughly about what our treatment looks like, and Just thank you so much for this opportunity to share a little bit more and to connect in the community. It's so important to have those resources.
It is important. And thank you so much. And for us, our philosophy is very simple here at Therapy Works. We are better together. And we understand sometimes it's very hard to take the first step to seek therapy and seek help. But when they do, we're here to help. And I appreciate what you do for our community. Thank you, Jennifer. And if you want to learn more about us, visit mytherapyworks.com. Again, it was a pleasure meeting you, and I hope we can meet again.
Absolutely. It was a pleasure meeting you as well. Thank you so much.